Hey guys, so I'm fighting a cold right now, so I'm sorry that it sounds probably bad and I'm sniffly, but I decided to do my autoimmune disorder presentation over rheumatoid arthritis. And basically, the type of disease is when the immune system attacks the synovium, which is the membrane lining of our joints, and it's like all the other ones, an abnormal immune response, and it causes inflammation and pain in the joints. How it responds is it attacks the joints and their linings. As for what causes the disease, they're not really sure, but they do believe that it's linked to the human leukocyte antigen and possibly 200 other genes. People with HLA have a 5-time greater chance of being diagnosed with RA. The thing is, people can go long periods of time with having no flare-ups, and then all of a sudden they can have it. So we don't know how long they've had it in their system. They think it can be brought on from being exposed to certain viruses or bacteria and your immune system being run down and then this popping up. It possibly could be linked to obesity. They think it might be related to female hormones because females make up 70% of the population that have RA. And then they also say that stressful events or trauma can cause this to flare up. And I do personally believe that. My grandmother was very active, and then I had an uncle commit suicide, and so when her son died, within a week, she was bedridden and couldn't walk anymore, couldn't get out of bed. And when she finally got all the testing done, they determined that she had rheumatoid arthritis. So I definitely agree with the possibility that stressful life events and trauma can cause these symptoms to really pop out and become active again. As for the prognosis, it's not a fatal disease, but people do believe that it can possibly decrease your lifespan by 10 to 15 years simply because with severe cases of rheumatoid arthritis, you're not as active, and so you may live a more sedentary lifestyle after getting the disease. As for treatment, there's no cure. They do suggest NSAIDs, like our normal ibuprofen, and then steroids. I know that they use a lot of steroids with that. Like my grandma used to take a lot in the beginning when she first got sick, but as for long term, it's kind of hard to use those, is what they told her. And then they have what they call DMARDs, and those are disease modifying anti-rheumatic drugs, and they are used more frequently now, and they have been able to put some people into remission. I know that my grandma goes in every 6 weeks, possibly every 4 weeks, and she gets an infusion, and it's basically a drug cocktail specifically for her. It's kind of similar to chemo, except one of the side effects can be it causes cancer. And basically, if she doesn't get that infusion, she becomes bedridden again, and it's pretty bad on her. As for the current research, they're working on all the genetic markers since they know that HLA is connected, but they do believe 200 other genes could be connected with rheumatoid arthritis too, so they're really trying to find out more about that, and they're just looking into more treatments and kind of figuring out how to help people cope and live with this disease, since a lot of this stuff is very expensive for those people who are having to pay for them. As for the statistics, like I already said, 70% of all people with RA are women, and it affects more of the age group 40 years to 80 years old. And they do believe that 40% of people with RA have signs and symptoms that are affected that aren't related to the joints. So 40% of all people with RA also have problems with their heart, lungs, kidneys, eyes, bone marrow. different things like that. So, hope you learned something.